Thank you all for coming today. I'm Marcel Nadaf, like Angela said, Regional Healthcare Director for Walgreens. I'm joined here today by our Governor, Asa Hutchinson. Welcome, Governor. As well as our Surgeon General, Dr. Greg Bledsoe. Thank you for being here. A member of their team, as well as some members of the Walgreens leadership here today. You will hear from the Governor shortly, and then we will open, as well as the Surgeon General, and then we will open the floor, if time permits, for a couple of questions. You may recall in February, Walgreens announced an effort to install safe medication disposal kiosks like the one to my left in 500 Walgreens stores across the country. Today, I'm pleased to tell you that we have delivered on this program. In Arkansas, Walgreens has introduced customer-safe medication disposal kiosks in 7 locations across the state. These kiosks make it easier for customers and patients alike to safely dispose of unused over-the-counter and prescription medication, including controlled substance, at no cost to individual, year-round. With our presence in communities across the country, Walgreens is well positioned to make the safe disposal of medications not only easier, but safe and available all year. Why is it important for us to offer safe disposal kiosks in our pharmacies? The fact remains, prescription drug abuse continues to be a public health and safety risk in our country. Studies show that more Americans die every day from drug overdose than from car accidents. In 2015 alone, 19 million people misused a prescription medication. And more than half of those 19 million people who misused a prescription drug have obtained it from a friend or relative. As a pharmacy, we are determined, and we could and should play a role in reducing the misuse of medications and help reduce the risk in overdose death throughout this program. Each day inside convenient Walgreens pharmacy in communities across the country, our trusted pharmacists play an important role in counseling patients on the safe use of their medication. But we also know that not all of the medication are finished by the patient. For a variety of reasons, as we know, the patient's doctor may have changed the medication, the patient may have gotten better and decided not to take it anymore, or they could not handle the side effects of medication and stop it altogether. And the question those patients have and is, what do I do with my leftover medications? As a pharmacist myself, I often heard that question. Many people don't realize it's not a good idea to flush them down the toilet, which can lead to environmental problems, and it's not also recommended to simply toss them in the trash without mixing them with different materials such as cat litter or coffee ground. We need to make the safe disposal of medication easier, and these kiosks do that. Using a safe medication disposal kiosk at a participating Walgreens is one of the best ways to ensure medications are not accidentally used or unintentionally misused by someone else. By installing safe medication disposal kiosks nationally, and by continuing to counsel our patients on safe medication disposal and usage, I'm proud to say that Walgreens is now leading the way in the fight against prescription drug abuse in our communities. Thank you all for attending here with us today. And now, let me proudly introduce to you our Governor, Asa Hutchinson.
Thank you, Marcel, and I just want to take advantage of the opportunity to thank Walgreens for their leadership in providing a safe method of disposal of prescription drugs. Habits are hard to break in America and among families, and for generation after generation, we've simply taken our prescription drug medication and left them in the cabinet We have done different things with them, but not safely disposed of them. And part of the result of that is that in many instances, it is teenagers, it is others that are taking leftover prescription medication and using them for themselves or selling them. And that leads to prescription drug addictions in our society, that leads to opioid addictions and heroin addictions. And so this is a very important initiative. As former head of the DEA, I'm delighted with the DEA's leadership in their Take Back initiative for drugs, encouraging businesses to have kiosks, but also encouraging families to pay attention to change the habits of a lifetime and actually return prescription drugs to a kiosk for safe disposal. And so I know that they've initiated that already nationwide this year, and I think it's over 6 million pounds have already been returned. And so I appreciate the DEA's leadership and continued emphasis on this and partnerships like they have with Walgreens. Yesterday I was in Washington County. I was in Fayetteville at a drug court graduation. And as the graduates have just completed their course of treatment after 1 year or 15 months of trying to overcome an addiction, you hear their story, and a couple of them, it was prescription drug abuse that got them into their addiction problem and crime problem. They're getting their life straightened around, but if we can take ownership of this early on, families retrain themselves, return those drugs, put them in a kiosk, then we'll be better off as a society. In Arkansas, we've had over 100 deaths in a year from prescription drug overdose. Those are lives that are wasted. We need to save those lives, and this is a good means to start. So I'm delighted to congratulate Walgreens for your support of this. Marcel, thank you for your leadership on it. I'm glad that these kiosks are not just here, but in other places across the state of Arkansas and our nation. And with that, I'll ask Dr. Bledsoe, our Surgeon General, to make a comment.
Well, thanks, Governor. And I certainly applaud Walgreens and their leadership. Nothing makes the Governor and I happier than having private sector folks step up and really dig in to help solve the healthcare problems of our state. You know, the opiate drug addiction problem is a huge problem nationally. It's a huge problem here in Arkansas. Anything we can do to attack this problem is a good thing. And this is just one of the spokes in the wheel to really help attack this opiate problem that we have nationally, taking back these medicines that are no longer used. But in addition to that, you know, even if you don't have narcotics or opiates lying around, it's important to take those old medicines and dispose of them because, you know, some of them will expire, and expired drugs aren't nearly as effective as drugs that haven't expired. Kids can get into them and play with them or ingest them, and that can cause problems. And then there's always the mislabeling problem. So you can have medicines that you might think are one antibiotic, for instance, and actually it's a different type of medicine, and those can lead to healthcare problems as well. So, you know, it's really important that if you have medications that are lying around, that you take care of those things in a safe way, like in these kiosks that Walgreens has provided. So we really appreciate the Governor's leadership on this issue, Walgreens' leadership on this issue, and we really encourage folks that if you have these medications lying around, please get them here to one of these kiosks and get rid of them.
Thank you so much, sir. Appreciate it. Thank you. Thank you so much for your comments. Greatly appreciated. So I think we have time for maybe a couple of questions. If anyone has any question regarding the kiosk.
That 6 million pounds number, what exactly does that represent?
The amount of controlled substance, I believe, that was collected this year in the United States.
By Walgreens?
No. Total.
Is this seen as perhaps a model that other companies can follow?
Absolutely. This is, again, this is something that we have pioneered as a company, and we launched it in 35 states, 500 stores, and we're encouraging all other pharmacy providers to do the same. You're welcome. All right. As a pharmacist, I'm very proud that we are taking an industry-leading position on this important issue, giving our patients real and practical solution. We encourage others to join us in this important effort to fight the misuse of medication. Thank you so much all for being here with us. It's an honor to have you, Governor, here, Surgeon General, and wishing you all a great week. Thank you.